Welcome to the very first lecture video for our Introduction to Pharmacy course. I'm really excited to get started with you today. So we're going to be thinking about the profession of pharmacy over the next 7 weeks. And I'd like to start off this discussion by dissecting those two terms. So in this video we'll think about what exactly is a profession. And in our second video we'll think a little bit more about what is pharmacy. And obviously we'll think about that for the next 7 weeks. So let's get started. I want to first begin by looking at maybe a simple definition of profession out of Webster's dictionary. And simply, as you can see, it says a profession is a calling requiring specialized knowledge and often long and intense academic preparation. Sounds pretty typical, right? That's what we might think a professional would need to do. But I really am interested in expanding that definition and thinking about what a professional is in this heuristic. I want to think about social utility, and I want to think about social sanctions, and I want to think about social responsibility. And that'll help us kind of flesh out this meaning of professional beyond kind of the simple definition that Webster provided to us. So let's just look at each of these terms for a couple of minutes. First is social utility. And what this simply means is that a professional is providing an individualized service that is of a socially necessary and important function. So let's say your health. Secondly, or thirdly, we would like to think that this is a specialized knowledge and skills that's required to provide that function. And finally, as Webster suggested, that it requires substantial training and study to get there. So we provide social utility as a professional. The second kind of heuristic I want to think about is social sanction. And here we see our first what I will call pharmacy fundamentals. So you see the green exposure here being licensure, and we will note throughout the course that anything that shows up green on our slides as we discuss them, we will consider these to be pharmacy fundamentals. And let me tell you, one of my objectives with you is that I'd like you to have a lexicon of kind of the vocabulary of this profession, and we're going to highlight a handful of those each video so that by the end of the course you've got kind of a vocabulary, you have a lexicon, that you know what all the contemporary terms are and you can use them. So the first of these is licensure, and we'll define licensure for you in a few minutes. So if a professional provides a social utility, they provide a very important function, it requires substantial training to get there and study and preparation, then that results in some sort of social sanction, meaning that the society is going to give us something for this investment that we've made. And the first thing that we'll talk about in terms of social sanction is licensure, that we get a license that allows us to do a certain thing that other people cannot do. Another part of that social sanction is that we provide autonomy to these professionals. So they have the right and the kind of freedom to practice their profession kind of as they see fit. And we'll see that there are certainly boundaries around that. There are regulations that must be followed and all the ethical parameters that we will discuss. But as a professional, we have a certain degree of autonomy in what we do and how we do it. And then finally, being a professional provides benefits and prestige. So professionals typically make more money. They have certain standing in the community. We know that pharmacists, as an example, have a high level of respect among the American public. So we have prestige or benefits. So we have social utility, providing a good service, an important service. We have the social sanction of licensure, and we can practice as we want, and we have certain benefits that come with that. But most importantly to me is this third heuristic of social responsibility. And we're going to really spend most of this course fleshing out this social responsibility and what pharmacists should and are doing. So what does this mean? It means that the pharmacist has an obligation to act in the best interest of others. That, as a professional or of any kind of profession, we say that we will act in your best interest. You'll see that there's our next pharmacy fundamental there in green, the word covenant. So we're going to define that for you in a minute. And we'll find later on in our course when we think about ethics, we'll see this word covenant in the Code of Ethics for Pharmacists. So it's an important fundamental word for us to understand what it means. Secondly, in terms of social responsibility, we have the responsibility to have what I will call intra-professional control, meaning that pharmacists or physicians or nurses or whatever the profession may be really exert control over each other. We must demand that our peers and ourselves meet certain high standards of practice, that we maintain competence and all those kinds of things. Social responsibility requires ethical behavior. We're going to spend a whole week thinking about regulatory and ethical considerations in this field. So certainly we demand the social responsibility tenet of ethics. And then we have the responsibility to gather with our colleagues, to help advance the profession, to help train ourselves so that we maintain competence, and all the things that our pharmacy professional associations do. And throughout this course, really, I'm going to kind of be sprinkling in some allusions to these professions and these associations, so that you can understand what the important ones are, and we'll see how they help us meet this social responsibility of maintaining competence and advancing the profession. And then finally, as part of that, what I just described to you in terms of association, we have the responsibility to maintain competence. So here I am. I'm toward the end of my career. I completed my pharmacy training many years ago, and quite frankly, much of what I learned in my undergraduate training as a pharmacist is outdated today. So as a practicing pharmacist, we must continually maintain, learn about the new drugs that are coming out, maintain information that's important to the patients, and maintain professional competence. So let's think about our first set of pharmacy fundamentals. And the first one that we remember was license or licensure. And I'll define that for you as permission granted by a competent authority to engage in a business or occupation or in an activity otherwise unlawful. We're going to have to meet certain standards. We get a license and we can practice a certain way or in a certain field. We're going to describe to you later on in the course how that license is obtained and how it's maintained, but I want you to understand fundamentally what it means. And then we have our second pharmacy fundamental, the word covenant. A usually formal, solemn, and binding agreement. It has kind of a moral tone to it, that we are kind of morally bound to act in the best interest of others. Now, another thing we're going to do in each of our videos is I'm going to pose a discussion forum question to you based on the content that we've just covered. These will be posted on our course website in the discussion forums. And I really would encourage you, as we approach our discussion forums this week, to think about these questions for the videos we've watched this week. And maybe we can have some discussion around them. So the first question I would ask you to think about and then maybe discuss on the forum pages is pharmacy a profession? And I want to give you a hint. And one of the things I want you to think about when you consider that, and maybe it seems like a kind of an obvious question, but think about this social sanction of autonomy as you consider your answer to that question. Well, that's our first video. And next we're going to think about more specifically, what is the profession of pharmacy?